Welcome to Cardiac Rehab. We are located at Doylestown Hospital on the first floor, just off the main lobby. Hi, my name is Dr. Stephen Sloan, Medical Director of Cardiac Rehab and the PAD Exercise Program. I'm very excited to review the benefits of cardiac rehab, how to control risk factors, and how our program compares to the national average. The use of certain cardiac medicines is very important to help prevent future cardiac events, hospitalizations, and reach outstanding patient outcomes. The medicines listed on this slide help patients in many ways, such as they slow down or stop the plaque buildup in arteries, reduce artery inflammation, and if there was heart damage, to reduce the size of the damaged area. Doylestown Hospital cardiologists use heart-protecting medicines up to 37% more than the national average. The use of cardiac medicines with a heart-healthy diet, cardiac rehabilitation exercise, and stress management is the best way to help you achieve the best outcomes. Lowering bad cholesterol, called LDL cholesterol, L for lousy, or L for lethal, is very important in stopping the progression of coronary artery disease. When it comes to cholesterol control, there are two groups of cardiac patients. Some patients do not have coronary artery disease. Their goal to prevent the disease is to get their bad cholesterol to under 100. The second group of patients have coronary artery disease. They need to have their bad cholesterol under 70. In both groups, Doylestown Hospital is 70% better at getting patients to the safe levels of bad cholesterol, the LDL cholesterol. If the cholesterol test was not performed, I will order it, and there is no extra charge to you. It's part of our cardiac rehab program. We're the only hospital that offers cholesterol testing as part of our cardiac rehab program. Heart failure patients benefit greatly by doing cardiac rehab. Our heart failure patients have huge gains in their fitness results. The bigger the increase in their fitness, the lower the rate of future hospital visits. We do a much better job at identifying and referring heart failure patients into cardiac rehab. Doylestown Hospital is 64% higher than the national average in heart failure patients participating in cardiac rehab. We strongly encourage our patients to work on all their risk factors and take their medicines as prescribed if they truly want to have the best result. Helping you to improve your fitness level is a very important risk factor we work on to prevent future cardiac events. Fitness is measured in METs. One MET is your resting metabolism. Resting metabolism is the energy expended or oxygen used at rest. The higher your MET level, the higher your fitness level. For every 1 MET increase to your peak fitness level, there's a 25% reduction in future cardiac events. Our exercise peak MET level results for our patients was 59% higher than the national average. Another way we know we help our patients achieve better outcomes is by an increase in their aerobic exercise minutes. The benefit of exercise starts at 150 minutes, and the benefit continues to improve as you exercise longer, up to 300 minutes per week. There is no benefit of doing extreme amounts of aerobic exercise, such as 500 minutes per week or more. In our cardiac rehab, we recommend you come to the outpatient cardiac rehab facility at least 3 times per week and exercise at home at least 2 times per week. Patients should exercise at a moderate intensity for a minimum of 5 times a week. The cardiac rehab staff is 74% better at getting patients to the correct amount of exercise compared to the national average. This is very important because it's related to a lower rate of future hospitalization and death. When a patient is very overweight, it's recommended that they lose 5% of their total weight. Losing weight can help in many ways, such as lowering cholesterol, lowering blood pressure, lowering blood sugar, and having less joint damage. We also want to reduce the waist size, which is measured just above the navel or belly button. Higher waist sizes are related to higher amounts of heart disease. For men, we were 100% better at reducing the size of their waist versus the national average, and for women, we were 75% better. Doctors assess weight by using a weight-height number called BMI. For most patients, the BMI should be under 25. For most overweight men, we suggest they lose 8 to 10 pounds in 12 weeks, and overweight women lose 5 to 8 pounds in 12 weeks. Significant weight loss in 12 weeks is defined as losing 5% or more of your total weight. Our significant weight loss percentage was 71% higher than the national average. Losing weight takes a lot of hard work with your diet and your exercise program. If you are struggling, I would encourage you to make an outpatient appointment with one of our dietitians. Blood pressure is the force of blood against the wall of the artery. A systolic blood pressure just 20 points higher than 120 doubles your risk of coronary artery disease. The blood pressure target has recently changed from less than 140/90 to less than 130/80. We were 14% better at getting our patients to this goal compared to the national average. Our resting blood pressure average was 119/65. High blood sugar levels can really speed up plaque buildup in the coronary arteries. If you have just one high fasting blood sugar above 100, you should have an A1C test. The A1C test gives us a 90-day view of your blood sugar control. A normal A1C test is 4 to 5.6, and the A1C goal for a diabetic is less than 7. Again, it is very important to order this test if your fasting blood sugar was high. We did a 46% better job at ordering the A1C tests and a 131% better job at getting our patients' A1C below 7 compared to the national average. We have a diabetic educator that works closely with our patients and physicians. It is very important to start outpatient cardiac rehab, and it's even more important to complete all of your scheduled visits. Most patients that have several risk factors and are new to exercise will be given 36 exercise sessions. Research shows that the more cardiac rehab sessions completed, the lower the rate of hospitalization and mortality. The quicker patients enter cardiac rehab, the more likely they will come. Hospitals that have a longer waiting time have less participants. Doylestown Hospital was 10 days faster than the national average at getting patients to start outpatient cardiac rehab. Our patients completed 23% more cardiac rehab sessions than the national average. We also had a 9.7% higher attendance rate compared to the national average. In summary, it's very important to enroll in cardiac rehab to make sure you have the best chance at getting all of your risk factors under control. If you do not have a referral, just call Cardiac Rehab, 215-345-2390. They will be happy to contact your cardiologist for the referral. Thank you for watching. See you soon.